Hello, this is Dr. Arnold Klein. I'm professor of dermatology and medicine at UCLA. I'm very honored to bring you this video because I think this is the only way that I can help you learn how to best employ these agents for soft tissue augmentation. My love affair with the needle began in 1979 when I attended a meeting given by the Collagen Corporation about their new product, bovine collagen or Zyderm, and how it should be injected. I went back to my office and employed these techniques of injection, and by and large they did not work. At that point in time, I began to try to develop the proper manner of injection, and by 1981 I published a paper on my techniques of injection of bovine collagen, or the serial puncture technique. I initially utilized injectable collagen to get rid of scars and lines. But even though I employed it to get rid of lines, the people just looked merely airbrushed. They didn't look necessarily better after I had completed my injections. Only in 1984, when I began to use the product for lip enhancement and return volume to the face, that I realized that aging mostly was about loss of volume and not the presence of lines, and that fillers, in order to give a more youthful look to the face, were best employed to return that volume that went away as the face aged. Soon I realized it was not just the lips that had to be enhanced. Also, as individuals aged, they lost the area of support from their lower lip to the chin, and it was proper positioning of the lips in space that was important. And even though individuals underwent facelifts, they still had the lower third of the face needing to be addressed. Also, I realized that while people look done after a facelift, they didn't necessarily look better, meaning that there is a time to pull, but also a time to fill. And I began to use fillers not only for lip enhancement, but also to fill the area between the lower lip and the chin. Suddenly, my world was invaded by a product called botulinum toxin, or Botox. It was my injection points and my dilution that was utilized in the clinical trials that resulted in the FDA approval of this to get rid of the frown lines. However, more importantly, I felt that Botox would be used to position the eyebrow, because the aesthetic center of the upper face is the eyebrow. So as Botox was being used in the upper face, it reawakened interest in filling agents in the lower face. And fillers are all about the lips. So it's the area about the lips that we look at and the area about the eyes that we look at that are the things that we view when we first view the image of a face. As most of you know, I'm in love with reading, and I was constantly in search of literature on how to build the best possible lips. I read everything in dermatology, and it wasn't there. I read everything in plastic surgery, it wasn't there. It was only one day in my dentist's office that I realized the rules on where the lips belonged in space, the proper positioning of the lips, were present in the dental literature, because it was all about the loss of dental support and the change in the mandible, or the loss of bone in the mandible, that caused the lips to change as we grow older. From the works of Leonardo da Vinci to the works of Keith Haring, art and medicine are sort of uniquely joined. Medicine at its best, as anything at its best, is actually really a form of art. So what we have to do is understand one thing. We're not only dealing with injecting substances, we're dealing with the art and the architecture, the support of the lower third of the face. And we have to also understand that we must approach this as we would approach art, meaning you go into the room and before you inject the patient, you observe their lips. You notice which side is larger than the other. You also know which corners go down. So the most important thing is to look, but more importantly is to see. And you have to do both of those things before you begin to put a needle into a patient. I hope you enjoyed this video as much as I enjoyed making it.